A lot of people still looking for health insurance plans that are right for them. Melody.
Natalie, thank you. Yeah, that's right. You know, the new deadline, March 31st for the Affordable Care Act. So we brought in an expert. Sarah O'Leary is the founder of Exhale Health. You are here to talk about some of the mistakes people make in healthcare. And this is not related to the Affordable Care Act. This is just for anyone and everyone out there looking for healthcare, or maybe people who are already covered that are being, I want to say, just had by their health insurance companies. And it happens a lot, correct?
It does. It is a matter of when we get health insurance, that's really the tip of the iceberg. The #1 reason for bankruptcy in the United States is healthcare related, medical bill related. So what we need to do is be ever vigilant and question.
Okay, so what are the 3 biggest mistakes people make when it comes to healthcare?
They don't negotiate their pricing up front. Almost everything can be negotiated. Call ahead. Your doctor.
Give me examples.
People don't know that you can negotiate the price of, or you should shop around the price of prescription drugs. One pharmacy will charge a different price than another, even against your health insurance card. So sometimes if you call in and say, what if I didn't use my insurance at all, you might get a lower price.
Interesting.
So that's an example.
Doctor's visits?
Doctor's visits, hospitals, any non-emergency procedure. You have to go get an MRI in your zip code, call around to the imaging centers and say, what price can you offer me? Make sure that your insurance company knows about your pre-certifications and is on board. So you can negotiate up front, but also we never negotiate on the back end. We get these bills and we think, oh my gosh, how do I pay them? Not, do I even owe it?
This is the problem. So we get these medical bills from, let's say you've had a trip to the ER or a trip to the hospital. Those bills are often astronomical.
Yes.
How do you know if you're even being charged the right amount?
You know, I have to say, to be quite honest, it's wildly complex. What we say is, if you can't hire professionals like what we do for a living to help you, get a buddy, get a trusted friend to walk through it with you. Take your explanation of benefits, that's the document, a summary document you get from your insurance company, and collect all of your bills that come from the hospital, the doctor, etc. Put them against each other and match. If it looks like it is too expensive, it probably is.
So take some time. I mean, this is not going to happen instantly. You've got to take some time and look through everything, correct?
Yes, you have to know your policy. You have to understand the constructs of your insurance policy. Sometimes the insurance company isn't doing their fair share. Sometimes the doctors are overcharging. It's called balance billing. Sometimes the hospital is using an arbitrary system called a charge master to figure out what it is you owe.
Wow.
It's up to you to be vigilant, empower yourself, and fight.
Okay, now one of your tips that's really interesting to me, you say it's important for people to make appointments to see their doctor now at the beginning of the year.
Yes.
Why is that?
In almost all cases, we reset our deductible with the calendar year.
Right.
So it resets January 1st. So if you're going to have to go get tests or procedures, get them done in January. Even if it's a mammogram and we know that October's Breast Cancer Awareness Month, do it in January. These are the costs that go against your deductible or can go against your deductible. Let's say you needed a surgery. So you want to be able to go against that deductible for the full 12 months, not just for a portion of it. But know when your benefits plan starts and ends. Some groups have different, they don't go against the traditional calendar year.
I love it. Sarah, thank you so much. Sarah O'Leary of Exhale Health, thank you. This is great information. I didn't even know so much of this stuff, but it's really important for our viewers to hear this. I appreciate it. All right, Natalie, over to you.